What is your cough trying to warn you about today? Irritation, a hidden infection, or early signs of lung damage you shouldn't ignore?
Welcome to Dr. Mercola's Cellular Wisdom. Stay informed with quick, easy-to-listen summaries of our latest articles, perfect for when you're on the go. No reading required. Subscribe for free at mercola.com for the latest health insights.
Hello, and welcome to Dr. Mercola's Cellular Wisdom. I'm Ethan Foster. Today we're decoding dry, wet, tickly, and chronic coughs so you can act on the right signals at the right time instead of masking symptoms and missing what your airways are asking you to address.
I'm Alara Sky. You'll hear how pollution, smoke, and chemical exposure accelerate lung aging when a cough means you need immediate care, why chronic coughs over 8 weeks demand evaluation, and how specific research-backed steps, like nebulized hydrogen peroxide, raw honey, steam, and hydration, can support recovery when used correctly and early.
Let's start with the role a cough plays. You generate a powerful burst of air, about 50 miles per hour, because sensors in your airways detect irritants and tell your brain to clear them. That reflex protects you. The goal isn't to silence every cough, but to understand what type you have so you respond appropriately.
A dry cough often follows a viral infection or exposure to dust and pollution. A tickly cough feels like an itch in your throat and commonly reflects irritation or allergies. Chesty or wet coughs produce phlegm as you clear infection or postnasal drip. When a cough lingers beyond 8 weeks, you treat it as a red flag for deeper issues.
You should seek medical attention sooner if you notice blood-streaked sputum, chest discomfort, shortness of breath, or unexplained weight loss. Those patterns can accompany asthma, chronic bronchitis, reflux, or even early lung cancer. Early diagnosis is where you gain the most, before inflammation scars tissue and restricts your capacity.
Environmental triggers matter more than most people realize. Fine particulate pollution and secondhand smoke inflame airways, reduce lung capacity, and accelerate lung aging even in non-smokers. If you live near heavy traffic or industrial sites or spend time around smokers, you'll likely cough more and recover more slowly until you change those exposures.
One simple test helps catch trouble early: spirometry. It measures how much and how fast you move air, revealing airflow obstruction before you feel severely limited. If you're over 40, have a history of exposure to smoke or chemicals, or your cough keeps returning, getting a baseline test makes future changes easier to spot.
Some cough-related problems are emergencies. A sudden dry cough with sharp chest pain and breathlessness can signal a pulmonary embolism or a collapsed lung. Heart failure can provoke coughing from fluid buildup. A rapid change in cough sound, severity, or pattern, especially with breathlessness, warrants urgent evaluation.
Diagnosis still begins with your story. Track when the cough started, what triggers it, whether there's mucus and what color it is, and any exposure to people with infections such as tuberculosis or whooping cough. Those details guide decisions about blood work, imaging, or breathing tests, and they make your visit more productive.
Now to what you can do that supports healing instead of fighting your reflexes. If your cough produces mucus, you aim to loosen and clear it. Hydrate through the day, use steam inhalation, and avoid suppressants that block expectoration. If reflux drives your coughing, elevating your head during sleep can reduce nighttime irritation.
Raw honey earns a place here. A teaspoon coats and soothes your throat and performs as well as many cough medicines for calming cough, without suppressing the clearing reflex. Stir it into warm water with lemon or an herbal tea. If your cough worsens, you reassess. But for many people, this is simple, effective support.
When a viral infection triggers your cough, nebulized hydrogen peroxide offers a direct, early-stage strategy. Your immune cells already deploy small amounts of peroxide against pathogens. Properly diluted, a fine mist reaches your nasal passages, sinuses, and lungs, the terrain where viruses replicate, supporting your defenses at the source.
Precision is non-negotiable. Start with 3% food-grade hydrogen peroxide and dilute to a final 0.1% in hypertonic saline at 1.5%. Make the saline by mixing 1.5 teaspoons of unprocessed salt into 1 pint of purified or distilled water. Avoid plain water. The lack of electrolytes can irritate airway tissue.
Nebulizing delivers the solution where it's needed. A desktop unit with a face mask uses about 1 teaspoon of the mixture over 10 to 15 minutes. At the first signs, scratchy throat, sinus pressure, burning in the nose, a new cough, use several sessions through the day. Many people notice improvement within hours when started early.
If the saline stings, lower the salt to 0.9%, about 1 teaspoon per pint, to create normal saline. During high-risk times such as crowded indoor exposure or heavy pollution days, once daily sessions can help maintain airway hygiene. If symptoms persist or intensify, you pause home care and seek evaluation.
Environment cleanup is part of the plan. Use air purifiers indoors, ventilate cooking spaces, and avoid smoke and chemical fumes. If you've recently quit smoking, a temporary increase in coughing as you clear accumulated mucus is common. It usually signals that your airways are beginning to heal.
Remember that not all coughs are infections. Dry, harsh coughing can follow allergies, reflux, or medications like ACE inhibitors. Productive coughing with yellow or green phlegm leans toward bacterial infection. Blood-streaked sputum raises concern that warrants prompt assessment. Matching the pattern to the cause is how you shorten the path to relief.
Think of this conversation as a framework. Recognize your cough type, remove irritants, use raw honey, steam, and hydration to support clearance, and deploy nebulized hydrogen peroxide early with the correct dilution when a viral infection is likely. Pair these steps with timely medical evaluation when duration or danger signs appear.
Here's your challenge for today. Keep a simple cough log for the next 72 hours, time of day, dry or wet, color of any mucus, known triggers, and any relief from hydration, steam, or honey. If you face early viral symptoms, prepare the properly diluted peroxide saline and schedule 3 short nebulizer sessions. Thank you for watching Dr. Mercola's Cellular Wisdom. We'll see you on the next episode.
Thanks for watching. Subscribe now and click the notification bell so you never miss an update. See you in the next video.